Yellow fever is a viral disease that is transmitted by infected mosquitoes. It is prevalent in tropical regions of Africa and South America, where it poses a significant public health threat. The virus is named after the yellowing of the skin and eyes that occurs in some infected individuals. Yellow fever is caused by the yellow fever virus, which belongs to the Flaviviridae family. The virus is transmitted to humans through the bite of infected Aedes or Haemococcus mosquitoes. Yellow fever cannot be spread from person to person. Symptoms of yellow fever typically appear within 3 to 6 days after infection and include fever, headache, muscle pain, nausea, vomiting, and fatigue. In some cases, the disease can progress to a severe form, which can cause jaundice, bleeding, shock, and organ failure. This severe form of yellow fever has a high mortality rate. There is no specific treatment for yellow fever, and the disease can only be managed through supportive care. Prevention is the best approach to controlling yellow fever. Vaccination is the most effective way to prevent yellow fever, and it is recommended for individuals living in or traveling to areas where the disease is endemic. Yellow fever is a significant public health concern in many parts of the world. It is important to take precautions to prevent infection, such as using mosquito repellent, wearing protective clothing, and avoiding mosquito-infested areas. With proper prevention and management, the impact of yellow fever can be minimized. Yellow fever is a viral disease that is transmitted by the bite of infected mosquitoes. The virus belongs to the Flaviviridae family, which also includes other well-known viruses such as dengue, West Nile virus, and Zika virus. Yellow fever is endemic in tropical regions of Africa and South America, where it causes outbreaks and epidemics that can affect thousands of people. The virus is transmitted by mosquitoes of the Aedes and Haemococcus genera, which are found in tropical forests and urban areas. The mosquitoes become infected when they feed on the blood of infected primates or humans. The virus replicates in the mosquito's salivary glands and is transmitted to a new host when the mosquito bites again. Humans are the main hosts of the virus, but monkeys and other primates can also be infected. Yellow fever has two phases, an acute phase and a toxic phase. The acute phase lasts for 3 to 4 days and is characterized by flu-like symptoms such as fever, headache, muscle and joint pain, nausea, and vomiting. Most people recover from this phase, but about 15% of patients progress to the toxic phase, which can be fatal. The toxic phase is characterized by jaundice, yellowing of the skin and eyes, liver and kidney failure, and bleeding from the mouth, nose, and eyes. The virus causes damage to the liver and other organs, leading to the symptoms of the toxic phase. The immune system also plays a role in the disease, as it produces antibodies that can either neutralize the virus or cause damage to the body's tissues. The severity of the disease depends on the age and health of the patient, as well as the virulence of the virus strain. Yellow fever can be prevented by vaccination, which is recommended for travelers to endemic areas and for people living in areas with ongoing outbreaks. Mosquito control measures such as insecticide spraying and elimination of breeding sites can also reduce the risk of transmission. Early detection and treatment of cases can prevent the progression to the toxic phase and improve the chances of survival. 1. Citrus fruits. Citrus fruits like oranges, lemons, and grapefruits are rich in vitamin C, which helps boost the immune system and fights off infections. This makes them an excellent food choice for those suffering from yellow fever. 2. Leafy greens. Leafy greens like spinach, kale, and collard greens are packed with essential vitamins and minerals that help strengthen the body's immune system. They are also a great source of antioxidants that help fight inflammation and reduce the risk of chronic diseases. 3. Ginger. Ginger is a natural anti-inflammatory and has been shown to help reduce fever and alleviate symptoms of yellow fever. It is also a natural pain reliever and can help ease headaches and muscle aches. 4. Turmeric. Turmeric is a spice that has been used for centuries for its medicinal properties. It contains a compound called curcumin, which has anti-inflammatory and antioxidant properties. This makes it an excellent food choice for those suffering from yellow fever. 5. Coconut water. Coconut water is a natural electrolyte that helps replenish fluids and minerals lost during fever. It is also rich in antioxidants and contains immune-boosting properties that help fight off infections. 1. Sugary foods. Excessive consumption of sugary foods can weaken the immune system, making it more susceptible to yellow fever. Sugar also promotes inflammation, which can worsen the symptoms of yellow fever. 2. Fried foods. Fried foods are high in unhealthy fats and can cause inflammation in the body. This can lead to a weakened immune system, making it harder for the body to fight off yellow fever. 3. Processed foods. Processed foods contain high levels of preservatives, additives, and artificial ingredients that can harm the body's immune system. These foods can also cause inflammation, which can make yellow fever symptoms worse. 4. Alcohol. Alcohol can weaken the immune system and dehydrate the body, making it more susceptible to yellow fever. It can also interfere with the effectiveness of medications used to treat the disease. 5. Caffeine. Caffeine can dehydrate the body and cause inflammation, making it harder for the immune system to fight off yellow fever. It can also interfere with the effectiveness of medications used to treat the disease. Yellow fever is a viral disease that is transmitted through the bite of an infected mosquito. The disease is prevalent in certain parts of Africa and South America, and travelers to these areas are at risk of contracting the disease. However, there are several measures that can be taken to prevent getting yellow fever. The most effective way to prevent yellow fever is to get vaccinated. The yellow fever vaccine is a live attenuated virus that provides immunity against the disease. The vaccine is recommended for all travelers to areas where yellow fever is endemic, and it is mandatory for entry into some countries. The vaccine is safe and effective, and it provides long-lasting protection against the disease. In addition to vaccination, travelers can take several other measures to prevent getting yellow fever. These include: 1. Avoiding mosquito bites. Mosquitoes are the primary carriers of yellow fever, so it is important to take steps to avoid getting bitten. This includes wearing long-sleeved shirts and pants, using insect repellent, and sleeping under mosquito nets. 2. Keeping the environment clean. Mosquitoes breed in stagnant water, so it is important to eliminate any standing water around your home or hotel. This includes emptying water from flower pots, buckets, and other containers. 3. Staying in air-conditioned or screened-in accommodations. Mosquitoes are most active at dawn and dusk, so it is important to stay in accommodations that are screened in or have air conditioning to prevent mosquito bites. 4. Seeking medical attention if you develop symptoms. If you develop symptoms of yellow fever, such as fever, headache, and muscle pain, it is important to seek medical attention immediately. Early treatment can prevent complications and improve your chances of recovery. By taking these measures, travelers can significantly reduce their risk of getting yellow fever. However, it is important to remember that prevention is always better than cure, so it is essential to take the necessary precautions before traveling to areas where yellow fever is endemic. Yellow fever is a viral disease that is transmitted through the bite of infected mosquitoes. It is prevalent in tropical regions of Africa and South America. The symptoms of yellow fever include fever, headache, muscle pain, nausea, vomiting, and jaundice. In severe cases, it can lead to liver failure, bleeding, and even death. There is no specific treatment for yellow fever, but there are ways to manage its symptoms and prevent complications. The first step in treating yellow fever is to diagnose it early. This can be done through a blood test that detects the presence of the virus. Once diagnosed, the patient should be isolated to prevent the spread of the disease. The most effective way to prevent yellow fever is through vaccination. The yellow fever vaccine is a live attenuated virus that provides long-lasting immunity against the disease. It is recommended for people who are traveling to areas where yellow fever is prevalent. In addition to vaccination, supportive care is essential in managing the symptoms of yellow fever. This includes rest, hydration, and pain relief. Patients should drink plenty of fluids to prevent dehydration and take pain relievers such as acetaminophen to reduce fever and muscle pain. In severe cases of yellow fever, hospitalization may be necessary. Patients may require intravenous fluids, blood transfusions, and other supportive measures. Treatment in the intensive care unit may be required for patients with severe complications such as liver failure and bleeding. In conclusion, yellow fever is a serious viral disease that requires prompt diagnosis and management. Vaccination is the most effective way to prevent yellow fever, and supportive care is essential in managing its symptoms. In severe cases, hospitalization and intensive care may be necessary to prevent complications and improve outcomes. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.